Get ready with me while I talk to you all about the first blood test that has been approved by the FDA to predict preeclampsia in pregnant women. If you don't know, I am a nursing student and I'm also a future midwife, nurse practitioner. And this is a big deal because I plan to work primarily and or exclusively with Black and immigrant women, and Black women are much more likely, and so are Latina women, to have preeclampsia much more often than white women. So preeclampsia is the number one death reasoning for pregnant people, and obviously if we can predict it sooner, then we can minimize the potential death for these women. And this blood test has a 96% accuracy, which is revolutionary if you ask me. Preeclampsia does not have symptoms that are very specific, so women don't know when they have it. The testing that's currently done is done between 23 and 35 weeks, and really the only answer to it is delivering the baby early. But if you don't catch it when it's happening, then the mother can die in the process. This blood test tests for two of the active proteins that are present or that do end up significantly causing the preeclampsia. So it's not just important because it affects the women of my demographic. It affects all birth givers, first of all, and second of all, if our country is suddenly going to force tons of birth givers to actually give birth, then they might as well be able to provide us with the most up-to-date, comprehensive health care, which we know they don't. Although there is no adequate treatment for preeclampsia, there have been some instances where magnesium sulfate has been used in order to be able to help or facilitate with preeclampsia. So predicting preeclampsia allows us to be able to monitor the patient a lot more closely. So I'm really excited about the implementation.